So now we're going to cover dynamic lumbar stabilization. Stabilization isn't concerned about how much movement we have, but rather how well you can control that movement. So there's two basic building blocks you need to have before we can get into any kind of stabilization exercise routine, or what's commonly referred to as core stability exercises. The first building block is what we call neutral spine. So I'm going to cover that now, and in the next section I'm going to talk about the second building block, which is the activation of the deep back, abdominal, and pelvic floor muscles. Neutral spine, if we look at how a spine is put together, it has these normal curves. So this is the back of you, and this is your stomach here. So we're looking from the side like this. If you look at the lumbar spine, or the low back in particular, it is curved towards the stomach. That's what we call a lordosis, and that's its natural resting position. When we bend backwards, we increase the lordosis. So if you have too much or excessive movement backwards, it will jam the back part of the spine and can cause pain. When we bend forwards, it reduces the lordosis. So that's called flexion, and if you maintain the spine too flexed, it can strain, again, the posterior or front part of the spine and cause pain or injury. So we want to try and explore the movements of the spine and find out where neutral is. The key is, once you understand where your neutral spinal position is, then you learn how to engage your core muscles to maintain that neutral spine as you begin to perform your movements of everyday living, including the core stability exercise routine. So now we're going to start to talk about how to explore that full range of motion and then find neutral in various positions.